accessing services is a critical problem for many families, transportation being the major barrier. How would you address this issue?
Again, we're back to funding, but I'm not sure where, if it's talking about certain areas not having public transportation in order to get families to where they need to go. You know, some areas do have assistance, whether it's the different organizations that will help young parents, young families, transporting to doctors or dentists, or another issue that will fall in line with this is not only the lack of transportation, but the lack of services, which makes the families have to travel at a greater distance in order to get services. My wife and I, foster parents, there were times when services weren't available for whatever reason, whether it's the provider didn't want to do the service because they've met their limit as far as how many Medicaid, Medicare patients or individuals that they would see. So there were times when we'd have to travel a distance just for one of our foster children to be seen by a doctor or dentist. Again, we talk about transportation, but services don't stand alone, transportation don't stand alone, and assessing and accessing these services don't stand alone. They intertwine, and I feel that we need to do a better job in making services more available in the area, and we would be cutting down the need for the transportation in order to have our younger families or those who can't afford transportation to get the services that they not only need but request.